Deoxygenated blood arrives at the heart from the body's systemic circulation via the superior and inferior vena cava. The first heart structure the blood enters is the right atrium. The right atrium passively fills with blood during diastole, which is in between beats. During this time, the right atrioventricular valve, also known as the tricuspid, is open and blood passively flows from the right atrium to the right ventricle. At the same time, blood is also arriving at the left atrium from the pulmonary veins after being reoxygenated by the lungs. During diastole, the left atrioventricular valve, also known as the mitral or bicuspid, is also open. This allows blood from the left atrium to passively fill the larger, more muscular left ventricle. During atrial systole, when the two atria simultaneously contract, any blood remaining in them is actively forced into the two ventricles. During ventricular systole, when both ventricles contract simultaneously, the decreased tension on the chordae tendineae and the pressure created in the blood-filled ventricles forces the one-way left and right atrioventricular valves to close. This prevents blood from backtracking into the atria. But each ventricle has another valve regulating the flow of blood into arteries. The pulmonary valve is between the right ventricle and the pulmonary trunk, and the aortic valve is between the left ventricle and the ascending aorta. These are also known as the right and left semilunar valves. These valves both open into the vessel, so when the pressure from the ventricular contraction is high enough, these valves open and blood rushes into the vessels. From the right ventricle, the pulmonary trunk routes blood toward both lungs for reoxygenation. From the left ventricle, the aorta routes the blood toward all of the systemic tissues of the body to deliver oxygen and nutrients and pick up waste products.